for being part of our special day. I'd like to introduce Jen Jensen with some reflections on the student nursing experience for the class of 2015.
Thank you, Jim. I would also like, on behalf of the class, I'll say we would also like to thank the following people. Nancy Gasowitz, Associate Dean and Director of the School of Nursing. Michelle Johnson, Director of the Practical Nursing Program. And the following instructors of the Practical Nursing Program. Jamie Crabb, Patty Greethurst, Jim Canola, Maddie Roos, Kristen Smith, and again, last but not least, Jamie Goodrow, our Senior Secretary of the Practical Nursing Program. Can we give them all a round of applause? Thank you also to my fellow students for allowing me the opportunity to be their serious voice. They elected me to speak on their behalf, and I truly am grateful for this opportunity. So, with that, we as a class would greatly extend our thanks to our family, our spouses, our significant others, grandparents, children, family, friends who are here present with us today and who have been with us through whether it's 20 years or it's 2 years to get us to this point. We really do appreciate everything that you have done for us. Class. It has been said by spouses of nurses everywhere, it's hard to live with a nurse because, unless you're bleeding profusely, with bones protruding from the skin, and you can't breathe, you won't get any medical attention or sympathy. This would be why I'm thanking our family members for all that you've sacrificed for us to be in this position today, and for all the future suffering that you will have to do because we have no sympathy for you. I've spent the better part of an entire year with this group of women and man. James, I did not leave you out. And also, Jake is not here. We do have 2 men. He's busy in Alaska. We've come to know each other very well. Sharing in our personal triumphs and tragedies has become second nature. The friendships and bonds that we have been formed throughout nursing school will last us a lifetime. For instance, we all know who will be late or early. We all know who will sit in the front, middle, or back of the class, and whose hand will go up first when a question is asked or a test question needs clarification. That would be mine, because it seems that in nursing school, my hand had a mind of its own. Nursing school may have been one of the hardest things that I have accomplished in my life. Getting in required almost a 4.0. A class of 40 completed this program, and all of them are type A personalities. Just ask all of these instructors. During this past year, we've survived nursing school by passing. But I've said on more than one occasion, I need to know this information. I need to know everything that's being taught to me. We all needed to know it. Passing's not enough. Our patients' lives will be affected by what we know, not by the grade that we receive. However, that does not discount the hard work that we put into receiving very high grades by this group of individuals. So at this point, let's acknowledge them for this remarkable accomplishment that we've all achieved, which would be all of our hard grades. More often than not, when I was answering a question, the first words out of my mouth to start my sentence were, "My mom had this," or "when my mom." Which is why I began this career in nursing. It's my hope that we all remember why we became nurses. For me, 6 years ago, I watched as my mother slowly declined when life-saving measures were not given to her. Her stroke could have been prevented, but I was 1,000 miles away trying to advocate for her over the phone with doctors and nurses. Many strokes, a coma, a year in rehab, and 6 years of illness have been the result of not having a patient advocate by her side. That's why I'm a nurse. I've been in the position to beg a doctor to give a patient what they need. I've seen the difference a caring nurse can make while spending months in ICU with my mom. And now, thanks to the LPN program at Northern, I've been given the opportunity to be that caring nurse. And here's what I've learned. Patients don't always remember the name of the nurse who makes a difference in their care and in their life. I'm not in this profession for people to know my name. But patients will remember the name of the nurse who didn't respect them, treat them with compassion, gentleness, protect their rights, and advocate for them. That name will forever stick in their mind. I want to be the name that isn't remembered. I want to make a difference in my patient's life every day and be remembered for advocating on their behalf and never to forget why I chose this career. We have an enormous responsibility and opportunity to do our best and remember what this feels like. Today, completing our LPN nursing school career, please don't forget our theory and clinical experiences and how being a new nurse feels. Whether it's a year from now, 10 years from now, or 30 years from now. The nursing profession is now including and counting on us to bring our honor and integrity to a profession that has held those things dear and in very high regard. I will close with a quote from Florence Nightingale. Nursing is an art, and if it is to be made an art, it requires an exclusive devotion as hard a preparation as any painter's or sculptor's work. For what is the having to do with dead canvas or dead marble, compared with having to do with the living body, the temple of God's Spirit? It is one of fine arts. I had almost said the finest of fine arts. Thank you.